Subjective measures include self-reports where the patients complete questionnaires explaining to what extent they have been adhering to their treatment plan. A frequently used questionnaire is the 10-item Medication Adherence Report Scale, MARS, which has a forced choice format asking for yes/no answers, and was originally designed to measure patients' adherence to medication for schizophrenia. One strength of using questionnaires is that they are cheap and quick to administer to a large number of patients. This will increase the ability to generalize any results to the target population. You can also obtain quantitative data about attitudes to adherence, which can then be statistically analyzed. However, they can lack reliability because you are relying on a patient's memory, and they may not recall accurately how often they had been taking their medication. One weakness of using questionnaires is that the validity can be an issue if patients give socially desirable answers. They may say that they have been following their treatment when they have not, because they do not want their doctor to know that they have not been taking their medication either at all or regularly. One way to overcome this is to combine the use of self-reports with biological methods such as blood tests to see whether the results correlate with each other. Clinical interview. A clinical interview is a dialogue between patient and clinician to help the professional gain information which will help with diagnosis and treatment. A strength of the clinical interview is that it can provide detailed, rich qualitative data about levels of adherence as well as reasons why they may not be adhering. For example, in-depth questioning will provide detailed data that can help improve patient adherence by providing researchers with a greater understanding of patients' worries and concerns. This increases both the validity and the usefulness of the measure. However, a weakness is that in comparison with questionnaires, which can be administered online, it is a time-consuming and expensive method of gathering data, and researchers may have access to limited funding to conduct their research, which might result in smaller sample sizes. It is also more time-consuming for the patient who may have difficulties attending due to having to have time off work, for example, meaning that there may be a higher dropout rate than would occur in a questionnaire-based study, thus lowering the generalizability of the findings. An objective method of measuring adherence is to calculate the number of doses that the patient should have taken, then count the number of pills left in a bottle and to compare it with the number of pills that should remain. Evaluating pill counting. This is a simple and straightforward method of measuring adherence. However, it does not measure how many pills a patient has actually ingested. If patients are aware that their pills are going to be counted, they could simply throw some away to avoid practitioners discovering that they have not adhered to their treatment, lowering the validity of the measure. One strength is that telephone pill counting has research support. For example, Kalichman and others, 2008, study showed a high level of agreement between telephone pill counts, home pill counts and viral loads in HIV sufferers. This is a strength as it suggests that telephone pill counting is a valid measure of adherence. Medication dispensers are portable devices that allow you to organize medication by day and time. These devices provide reassurance to the patient by dispensing the correct pills at a set day/time and can use visual or audio alarms to alert the patient. The automatic medication dispenser records the date and time a pill leaves the device and how often it has been used. Some medication dispensers also use alerts in the form of SMS and ML messages as a reminder to take medication. Evaluation of medication dispensers. One advantage of this method is that it provides a reliable way to measure adherence which is not affected by social desirability or errors of memory. There is also an obvious advantage to the patient who is more likely to stick to their treatment with reminders, meaning that they are less likely to relapse and be admitted to hospital. One disadvantage of medication dispensers is that they may not get accurate results. Although the dispenser may record the medication being removed, this does not mean that the person has taken the medication. This means that this method lacks validity. In addition, the usefulness of the medication dispensers may vary with age, with older patients showing lower levels of adherence even with the use of dispensers. Some found the alarms irritating, whereas others forgot to charge the dispensers up. Biological measures can give an objective measure of the amount of medication that has been taken. The two main ways to biologically measure adherence is through the use of blood or urine samples. These measures not only help identify adherence, but also can identify what is the most clinically effective dose for the individual patients. Urine analysis. This is a fairly cheap way of collecting and testing for adherence. It is easy for the patient and totally non-invasive. In addition, urine is stable. This is when their chemical properties do not change, for up to 14 days at room temperature, and with standard refrigeration. Also, urine sampling gives objective visual results unlike self-reports blood sampling, as well as traditional methods of blood testing. Dried blood spot, DBS, testing can be carried out. DBS testing comes from collecting several drops of blood on filter paper. Drug levels in red blood cells can then be seen. Bernier, 2020, showed that DBS testing can show levels of hypertension drugs reliably, and that results were as high as using plasma. Plasma carries blood components such as nutrients, hormones and proteins through the body. When separated from the rest of blood, plasma is a light yellow liquid which can be used for testing. One strength of biological methods is that they provide an objective and visual cue for the patient and doctor about levels of adherence. Unlike subjective methods, there is no social desirability bias from a blood test, and therefore the results are reliable. The feedback from the test will allow a constructive conversation to be had between doctor and patient, especially if there are signs of non-adherence, meaning effects on health can be minimized. One weakness of biological methods is that drug/drug and drug/food interactions or differences in individual metabolism, rate at which drugs are broken down/used up by the body of the drugs may interfere with how accurate the results are. Therefore, this method should not be used if patients are on more than one type of medication. Another issue with blood tests is that they are invasive and some patients find them unpleasant and stressful. Therefore, they are not a suitable measure for all patients. Therefore, an idiographic approach to measuring non-adherence may be more appropriate, so that people are not made to feel more stressed or uncomfortable.